Jonathan. Jonathan. Okay, so most of you, by the way, I'm Mark Pettinger, spokesperson for the OLCC. I'm joined by my colleague Jonathan Modai, who's from the Oregon Health Authority. Most of you attended the commission meeting, but we do have some media on the phone. So we're going to do a sort of a short review of things, but we will kind of outline what we're going to do right now. So we will introduce our staffs, then our executive director will make a statement. OHAs and the state's epidemiologist will also make a statement. We'll do a quick review of where we stand, and then we'll take your questions until you're exhausted or we're exhausted, whichever comes last. That sound all right? Okay. So everybody got a copy of the press releases, the rules, and the names of the OLCC and OHA speakers? Okay. So I'm going to do the introductions first for our staff. So to my left at the far end, standing next to Commissioner Matt Miletus in the coffee cup is Steve Marks, our Executive Director. Going down the line, Shannon Hoffeditz, our Director of Compliance. TJ Sheehy, the manager of our Marijuana Technical Unit. Anthony Geltowski, who's our Packaging and Labeling Specialist. Kelly Rout, who's the Director of our Administrative Policy and Process. Those are the folks who do the administrative hearings. And next to her is Danica Hipschman, who's our Senior Policy Advisor for alcohol and marijuana issues.
Hi, I'm Jonathan Modai. I'm Communications Officer at the Oregon Health Authority. I am joined by Dr. Dean Seidlinger. He is Health Officer and State Epidemiologist based at the Oregon Health Authority Public Health Division. I'm also joined by Karen Gerard, who is the Manager of the Health Promotion and Chronic Disease Prevention Section. And I'm joined by Sarah Wiley, who is a Health Promotion Strategist in the Health Promotion and Chronic Disease Prevention Section.
So just to recap, Oregon Health Authority has filed its rules, its temporary rules on the vaping ban. The OLCC Commission voted and approved its rules. Those will be posted shortly on our website. The temporary ban does not go into effect until Tuesday. OLCC marijuana inspectors will be making call downs to our licensees beginning tomorrow, Saturday, to inform them of their obligations and also to point out the resources that are available to them to refer to so that they can be in compliance with the temporary rule. After that, at some point, our inspectors will be in the field checking both processors and retailers, because this also affects our processors. In addition, part of this ban, the temporary ban with regard to nicotine, affects our alcohol licensees, specifically our liquor agents, retailers that sell beer and wine, and bars and restaurants that may stock those products. So we'll be reaching out to them as well separately. Our colleagues from OHA will point out the sign that's required for posting in all of those impacted and affected licensees. So those will be both the marijuana retailers as well as all of the various alcohol licensees that stock nicotine vaping products. With that, I'd like to turn it over to Steve Marks, our Executive Director.
Hello, welcome. Thank you for being here. Just want to put a little context around OLCC's role here, OLCC's evolution. As you recall, we got this responsibility for marijuana under ballot measure 91. We've moved forward with it, but our main focus when we started was we were a public safety response, right? We were looking at the diversion of marijuana, how to keep it in the state. I think this vape crisis has really highlighted the fact that this agency and its mission and the importance of it around regulating marijuana is also about consumer protection. Now, we've always had that concern. We've seen it. We have this agency and the people that worked on marijuana with OHA put in place the first most rigorous pesticide testing rules in the nation. We put in place the pre-approvals of all of the labels for marijuana, which other states don't do necessarily, and I think it's a best practice. But, we have our issues to evolve, and this vape crisis obviously pointed that out. So, we're becoming more of a consumer protection agency, one that's still trying to create a marketplace for our agency. But as our chairman said, when you have a health emergency like this, the overwhelming, overriding concern is to be sure that we protect the citizens of Oregon, protect the people that are using our products, and with the information that we understood from the investigation with OHA and CDC and from our own work looking at some of the safety sheets on these additives that go into flavor, it became very clear that we needed to take pretty precipitous action. I am grateful that the governor stepped up and put forward the executive order that gave us the ability to move forward quickly on this, and very proud of my commission for being willing to take quick action. So with that, that's my opening, and we'll be here answering questions, but I'll turn it back over to Jonathan.
Yeah. So we have been communicating with our stakeholders. That includes local public health authorities. We've been working with clinicians around the state, communicating to them. We are working to talk about the new rules with retailers, getting the word out there. And so we've been meeting, since the governor's executive order happened last week, meeting daily, multiple times a day, to coordinate really a lot of communication about these rules. And I should add that we also, in addition to the rules that were filed today, we filed rules on Wednesday that referred to ensuring that providers, healthcare providers, report to us this very specific illness now that is vaping associated lung illness, and so they will now be required to report that to the agency or to local public health authorities. So one other thing I wanted to add is we have samples of nicotine replacement therapy as well as samples of some vape products here. So if you have an opportunity, take a look at those. So I would like to just introduce Dr. Dean Seidlinger. He is, again, our health officer and state epidemiologist, and he can talk to you a bit more about these rules as well as our history with these types of products. Dr. Seidlinger.
Thank you, Jonathan, and thank you everyone for being here to help us get the word out. Today, as you heard, OHA and OLCC filed our emergency rules that'll ban the sale of flavored vaping products in Oregon for 6 months. This is in response to Governor Brown's executive order on October 4th. This is in light of the continued outbreak we see of severe respiratory injury across the country and in Oregon, with almost 1,300 illnesses or injuries nationwide, including 26 deaths. And that includes our 9 cases amongst Oregonians and 2 deaths in individuals who developed this severe respiratory injury following vaping. It's important to note that most of those cases reported vaping of THC-containing product, with some of them using exclusively THC-containing products across the nation, but a subset of them also vaped exclusively nicotine-containing products. And as of this date, in working with the CDC and the FDA, we still don't have a definitive cause of this injury and what ingredient or ingredients are causing it. Along with this outbreak of respiratory injury, we continue to see an alarming increase in youth use of vaping products. In Oregon, almost 1 in 4 11th graders report using a vaping product currently. Most of those youth use a flavored vaping product, as do many adults. So we continue to get the message out that nobody should vape. Vaping is not a safe practice. And that if you are currently vaping, we urge you to stop. There are FDA-approved nicotine cessation products available through the Tobacco Quit line. If you contact your healthcare provider, they can also assist you with cessation resources. And if you're vaping a product other than nicotine or tobacco, there's help for you in quitting using that substance. Again, reach out to your provider, or we have some hotlines here where people can call to get help with that. If you're currently vaping, and we urge you to stop, not change to combustible products, and those who aren't vaping really shouldn't stop, especially in light of this acute outbreak. This ban on sale of flavored tobacco products will go in effect on Tuesday across both the nicotine and tobacco market, as well as the THC and marijuana market, as you've heard. Development of these rules really has been a collaboration across state agencies, and again, we appreciate the directive from the governor in helping us to address this crisis in a timely manner. The enforcement of the ban on nicotine and tobacco products will be overseen by the Oregon Health Authority and really will be a partnership with our local public health agencies, including our environmental health specialists and our tobacco prevention and education program. And those reach outs to retailers will begin next week and will continue until we've contacted all of those retailers and then provide them information and education about the ban and what will happen with enforcement. It's important also to note that this ban is not the only thing that's going into effect as a result of the governor's order. The ban on flavored vaping products is accompanied by other resources that we hope will get people to stop vaping. There will be the consumer warnings in retail locations that you can see here. We are working with our healthcare providers and our insurers to reduce barriers to accessing cessation services, including increasing the access to nicotine replacement therapy for all those who call our quit line. And we will be stepping up our statewide prevention campaign around vaping, primarily with an online presence, directing people to cessation resources for those who want to stop. In addition, while cases of vaping-related injury have been reportable to the Oregon Health Authority based on the unusual occurrence of these, this was spelled out in new emergency rules that were released to our medical partners and our local public health partners on October 9th, with case definitions and a request to report those within 24 hours to us so we can continue the investigation. We look forward to continuing to work across state agencies and to work on the legislative proposals that Governor Brown directed us to work on that will help put a more long-term solution to the vaping crisis that we see, not just for this current outbreak, but for the alarming increase we're seeing in youth use. So I think with that, we are ready for questions or...
So Jonathan and I are fairly familiar with most of you, but I'd ask for the staff from OHA and OLCC if you'd just identify yourself as you ask your question, at least for the first go-around, and we are open for questions. Christian? Christian Foden-Wenzel with OPD.
One thing that struck me was, how does this ban affect anybody shopping online? And can people get around this ban by just going online and buying flavored stuff that way?
Online sales of flavored vaping products will be banned in Oregon. So these products cannot be purchased in person or online or by any other means in the state of Oregon.
But I could go to the state of California or somewhere else and buy it and have it shipped to me online.
They could not be shipped. If you are having them shipped into Oregon, purchasing them, having them shipped into Oregon, that would not be allowed.
I'm Mike Turner with KXL. CDC targeting vaping of THC. Now, are we missing something by not also placing a ban on THC vapes as well as cigarette vapes?
I'll just say, in general, we've known about the hazards of vaping, with tobacco-containing or nicotine-containing vape products, that there have been acute lung effects that we can see from that, as well as systemic effects from the absorption of the nicotine on the cardiac system. While many of the ingredients that are included in vaping products, particularly the flavors, are what's called generally accepted as safe, that's for consumption, kind of eating them, and not for vaping into your lungs. So we've known about the hazards of vaping for a while. with this acute outbreak of lung injuries, we don't see a specific product that they're associated with, which is why we recommend the stopping of all vaping products. But for the sales ban, what the governor directed us to do is to remove those flavored vaping products. And that's one of the product categories, I think, both on the THC side and on the nicotine side, that's attractive to new users and maybe for the more casual user a reason that they're using them. So by removing these products, we think we're removing an incentive for people to start vaping or for a subset to continue vaping. And that's why we really stepped up our efforts to get out information on cessation services, including nicotine replacement, and are pushing connections to substance use disorder treatment for those who want to stop vaping, because no level of vaping is safe.
I was curious, Sam Stites from Jamaica. I was curious how this will affect CBD vapes. You talk a lot about nicotine and THC. Where does CBD fall in this?
So no flavored vaping products will be available, including tobacco, nicotine-based products, CBD, hemp, or marijuana-based products.
Megan Vesco with KGW. Can you put a number on how many retailers we're talking about that you have to contact and now inform them of these new rules? And then what's the scope of the enforcement options that you have available to you?
Start, or do you want to start?
Cannabis or
Okay.
cannabis or
All of the above. I mean, from a statewide ban on flavored vaping.
Right. So I'll start from the Oregon Health Authority with our tobacco control program has a responsibility for enforcing the rules on the nicotine and tobacco side. While there's not a specific tobacco retail license, we anticipate that there are around 4,000 retailers who sell nicotine or tobacco-based products in the state of Oregon, with a significant number of them selling vaping products. So we will be working with our local public health partners, both on the environmental health side and the tobacco control side, to reach out and contact all of those individuals. We will send letters to those businesses, but also do as much reach out in person or over the phone contact as we can in the next 3 weeks to provide them information on this ban, the public health impacts for their customers, and then begin an enforcement process that mirrors the current tobacco enforcement process, which includes secret shoppers coming in, and if products are bought, follow up on enforcement activities. So I'll turn it over to OLCC for their side.
And I'll bring up Shannon Hoffeditz to talk about this. She's our public safety director. But let me say, we got much more extensive controls. There are licensees, and these rules that were put into place have the penalty of potentially losing your license for violation. So we have significantly greater control over the environment of use than our partners at OHA. Shannon?
Starting tomorrow, we will start calling our retail licensees. There is about 650 of our retail licensees. We'll be calling to inform them of what the emergency rule entails and what they need to do with the product. And then we will also be contacting our processor licensees that have the extractor endorsement. There's about 200 of them. Once the emergency rules go into place on Tuesday, October 15th, we will be going out conducting inspections, confirming that our licensees that this affects are in compliance, and working with our Administrative Policy and Process Division to go forward if there are compliance actions.
Blair with Mercury. So you're going to allow still the sale of vape products that are all natural marijuana derived terpenes, is that correct? So what percentage of sales are those products?
TJ Sheehy, our analyst, will come up and address that, and he'll tell you of some of the difficulty we have with our tax categorization when we started Metric, and the way people enroll their own information is they have their own names on it, so TJ can tell you more. But we're obviously part of the evolution is also refining our metric system so we understand more detail what we have.
Sure. TJ Sheehy, I'm the manager of the Marijuana Technical Unit. So our best guess is about 10% of vape product, 10% of the market are vape products that would be subject to this rule that went into effect. As Steve mentioned, that's a little bit tricky to define because to date, all of the categorization in the state of Oregon has been based on how something is made, right? An extract or a concentrate or an edible. It's not based on how it's consumed. And so that's an area where it's hard to pin a specific number down because this rule is effective based on both how it's made and how it's consumed. And so that's a number that we're, as Shannon said, we're going to have enforcement. As Steve said, we have a greater control of our licensees. We can directly inspect processors. We do labeling pre-approval on the items. So it's something we have eyes on, but in terms of a global number, our best guess is about 10% of the market.
That will be affected by the ban, and that's cannabis.
Yes, on the cannabis side, correct.
I have a follow-up question. If you go into an OLCC dispensary, right, there's the vape pens that are like grape and cherry, and then there's ones named after strains. Is it safe to assume that those strains only have naturally derived terpenes, or no?
Short answer is no. So this rule also extends the ban to not only artificial flavors like grape, cherry, those sorts of things, but on the marijuana side, non-marijuana terpenes. And so if those strain names are derived from marijuana terpenes that are processed within the regulated, tested OLCC system, those are allowed. If those are coming from external sources of terpene mixes of unknown sourcing, unknown contents, untested, they are subject to the ban.
So is it possible that a store wouldn't know, though?
If an item is accurately labeled, they would know. Anthony Giltoski in the commission meeting, he's our packaging and labeling specialist, provided an overview of what people could look for. But if it has a non-marijuana terpene or some other flavoring ingredient, a compliant label would list that as both the product identity of what the person's buying and ingredients on the label.
Thank you.
Just a minute, we're going to take a call from, see if there are any questions on the phone line. Any journalists on the phone who'd like to ask a question? I'll try again. One last time, any journalists on the phone line who would like to ask a question? Okay.
I actually had a follow-up to what was just spoken about, let's say with K2 News. Just for consumers, if they go to these stores, what exactly should they look for on their label if they have products already maybe at their home?
Anthony Giltoski.
One of the things they want to look for is two things. They want to look for the product identity, which is right on the front of that label, and the product identity will say something like cannabis extract with non-marijuana derived terpenes, or it'll say grape-flavored cannabis extract, something like that. And they can also look at the back, and on the back is an ingredients list. That ingredients list will show there's non-marijuana terpenes in there, artificial and natural flavors. So those two things are really strong indicators that the customer might have something that is subject to the ban.
We have some FAQs that we're going to post on our website that will have a couple of examples of what that looks like.
Just to clarify.
Fedor, can you stand up and ask your?
Oh, sorry. Fedor Zarhan with the Oregonian. So just to be absolutely clear, so if it's a terpene that is say, the same chemical that is in marijuana, but is extracted from something like lemons, but it's the same chemical, is that allowed or not?
No, that would not be allowed because that would be classified as a non-marijuana terpene, and that would be prohibited.
Quick question, I'm Sophie Peel with Milano Leaf. So you guys briefly mentioned an exemption process for some mechanically derived terpene companies. Will you guys explain that just a little bit further?
Danica Hibschman.
Thank you. I'm not sure how much clarity I could give to it right now. What we put in rule is that by the 15th of November, OLCC will develop some standards and a process for people to request an exemption. What that is going to look like, we don't know right now, but over the next 30 days, we'll be developing that, and we will certainly put out information on what that would be. I envision that it certainly is going to include some pretty stringent testing requirements, possibly requiring source materials for these terpenes to be tested to the same standards that Oregon marijuana is, and also some credible information that those products actually are safe for inhalation. That's just kind of what our thoughts are initially, but I think that will develop over the next 30 days.
We're streaming this, can you go through the basic caveats of that exemption?
Sure. This is really going to be for those, there's a segment of the industry that is using these non-marijuana terpenes currently, and so we are hearing a lot from them, and I think there is a lot of unknowns right now in terms of what's actually causing and what would be safe, and so we built this mechanism in so that if a processor is creating a product that is made with these non-marijuana terpenes, we will develop a process and standards by which they could request to have those be exempt from the ban.
One other element to add here, there's questions about the sort of like-for-like terpenes of the sourcing. Our concern is less around a specific terpene from lemons. It's a terpene mix of unknown contents from an unknown source that's untested. The safety sheets that we've seen say that it contains specified terpenes, but then it also says It contains other naturally derived or artificially derived ingredients. There are fillers in these mixes that even the people buying these products don't know what's in them because the specific contents and the specific percentages are withheld as trade secrets. Those safety sheets also say do not vaporize. So there's going to be an exemption process where people can prove up to the fact that these are safe for inhalation, they're known, and they're tested to the same standard as Danica said as marijuana. But the primary concern is the black box of terpene mixes that are used today.
Yeah, Lisa Bailey from McCoy, just looking for Dr. Seidlinger for a moment. Question some people wonder is that with the illnesses and the deaths, why not put a ban on vaping as a whole in place?
So, as you know, the governor's request to OHA and OLCC was to look at all options up to and including a ban. Initial recommendations that went back included a full ban, but upon further discussion, it was determined to remove the products that are most attractive to new or naive users, as well as the kind of more casual user. And that's why we are stepping up our effort to ensure that others who are vaping who would choose to use a non-flavored product have options to get off that vaping, because we in public health do not consider any level of vaping safe. And so we want to make sure that people have options, whether it's nicotine replacement therapy for their nicotine addiction, which is highly addictive and hard to kick, or access to substance use disorder treatment, including cognitive behavioral therapy, other evidence-based methods for those who want to get off marijuana so that they can stop vaping and stop putting chemicals into their lungs, which haven't been proven to be safe. As you've heard, the terpene mixes have pretty scary warnings on them, and the glycerol and other fillers that go into these vaping products, while they're safe for human consumption, meaning eating them, no one has tested them or really fully looked at their impact on health, but we do know that they cause immediate kind of lung effects and cardiac effects, and the long-term nature of these diseases isn't known. And with these vape products having unknown ingredients that are now causing this acute respiratory injury that is striking predominantly at youth and young adults, it's a time to really reconsider a habit that we know is not safe, and we really urge people to quit regardless of any products that are available on the market.
Christian, Odenbenzel with OPP. So given that the flavorings in vape have been around for many, many years, and that the illnesses have just started up, seemingly, how much of an effect do you expect the flavor ban to have on these illnesses?
We hope that the flavor ban that we have here, other states have considered, as well as the kind of increased attention on the dangers of vaping, the lack of safety information that we have about vaping will cause people to stop vaping, or more people to cut down on vaping, and that we'll see a decrease in these injuries. As the CDC reported today, we are still, unfortunately, week over week seeing an alarming increase in reported injuries and tragic deaths across our country, the vast majority of which have been in young people, young males in particular. So the flavor ban is one step, we hope, in helping to control these injuries. We do know that in the past there have been acute lung injuries associated with flavors. There's a condition which is colloquial called popcorn lung, which was first noticed in factory workers who prepared microwave popcorn and some of the artificial butter flavorings that went in. And that same illness was seen in people who were using vaping products several years ago. So there could have been some smoldering underlying illnesses that we weren't picking up and putting together that now we're picking up more, or a new injury that's occurring, whether a direct chemical burn, which is what some of the pathologic specimens have shown, or a pneumonia or pneumonitis caused by the fat solutes that are in there. But the fact is we just don't know which of those ingredients are, so we're working together to take this action to try and protect the public's health as much as we can, remove some products, but also get people alternatives they need to vaping.
I just want to add to this one that, we are doing a flavor ban right now in response to the governor's executive order and making that happen. That's not where our responsibility ends. Our responsibility is to look at all of these things. We'll be looking at the MCT oils and other additives, polyglycol, PG? Propylene glycol, as well, which have been, subject within the industry when we went around this summer doing a tour to some discussion about whether that's an appropriate substance to be in there. So we will be looking at these other things. This is not the end. This is a step on the governor's ban on flavors.
Jillian?
Yeah, Gillian Plackett, Associated Press. I don't know, are you guys concerned that people may just go to the black market to get their flavored vapes? Because there's, you know, a lot of these are from illicit brands that are being sold in LA, California, and all over.
So yes, and the black market exists. We've done a pretty good job of addressing it in Oregon. You know, we get about a 55% adoption rate of the OLCC system, but it's always been an alternative to the OLCC system and the dominant system before. What I hope and what I think we're seeing as this industry evolves is a much more sophisticated consumer, a consumer that can find and understands their safety, has come to find the convenience of the OLCC alternatives to be something that they want to use. And so, yes, while we're concerned, I think, you know, this system has to prove itself as the system of commercial preference for individuals who want to use marijuana.
Question for the OHA. Up to this point,
I'm sorry, who are you with, and who are you?
Sublime Solutions.
So you're not a member of the media.
That's correct.
So we're going to just take media questions right now.
So question actually for OHA.
Fedor.
So I'm curious about the tobacco retailer enforcement component, because, you know, as you mentioned, there isn't a tobacco licensing program. And so I was just looking at a federal report where there's about 3,170 retailers in the state, OHA contracts with OSP, which does about 1,500 inspections a year. So the question is, well, first of all, OHA, to my understanding, doesn't actually know precisely how many retailers there are, where they are, what the contacts are. A, B, the inspections happen through another agency, which inspect half of the retailers. So the question is, how is OHA going to, what are the plans for scaling up,
Right.
for identifying the retailers, inspecting them, what's the money coming?
Right. So in working across state agencies and various lists, that's where we came up with the number of about 4,000 retailers that sell tobacco or nicotine products throughout the state, looking at taxing rolls and other things. So we feel like we have a pretty good understanding of the number of retailers who are out there. Knowing that that's a significant step up to inspect all of these retailers, get them information on the ban, and assure that they are not selling products that we think are going to be harmful to their consumers. That's why we are reaching out to our local public health authorities and partners throughout the state to see if we can use an existing workforce, our tobacco prevention and education program staff, as well as environmental health specialists who are in those counties inspecting other businesses, to have them come together, come up with a plan of how we can cover all of these retailers and provide them information within the first 3 weeks of this ban. It's a large lift. We know we can't do it alone. We know we can't rely on the existing Oregon State Police enforcement effort, and that's why together with OHA and our local public health authorities and others who are on the ground in these communities, we think we'll be able to reach these retailers and then go into an ongoing enforcement effort, which on the tobacco and nicotine side will mirror what we already do, which is a series of secret shoppers going in and then addressing illegal sales, as well as a complaint-based system. So we encourage anyone in Oregon, after this ban goes into effect, if they notice a retailer who is selling a flavored vaping product or they suspect it, to be able to report that to us so we can go out and do that investigation immediately.
So how many more staffs there are going to be for this funding? I mean, do we have an approximate figure?
Yeah, I don't have an approximate figure. We're working right now with our local public health authority partners to find out how much they can step up now with their existing staff, working with them to say, we know you have other objectives you're working on in tobacco control. Which of those can we put on hold so that you can concentrate on this? And how easy is it for you to bring on some temporary staff if you feel that might be needed? And that request really just went out to our local public health partners. We anticipate having those back early next week so that we can start looking for places that may need some additional help or coverage and how we can do that. Because unlike on the OLCC side, we don't have as strong a regulatory control or contact with these retailers, so it's going to take us more time to kind of step up this effort, but we're encouraged by the response so far from our local public health partners.
Let's go with Portland Tribune, then KGW, and then Willamette Week. Did you get your question answered?
Yeah, but I have one.
Okay.
Yeah, I had, just talking with the industry folks in the room, it sounds like some folks are gonna have to lay off potentially 50% of their staff. Is the state looking at any resources to offer to these companies that might have to scale back in this 6 months?
We're not at this point, and this isn't the first decision that we've made for regulating in a regulated licensed industry that affects their profitability, their businesses. You recall when we started up, we had a real problem with processors and getting product tested at that point. We got through that without giving up our testing regime, but there's no doubt there were some businesses that were affected, lost. Some people lost their businesses and are back in the industry now and have recovered in that way. But so there's no plans. This is a private, competitive market on that side, and we're meeting our responsibilities in the regulated market to protect the public.
Any predictions or goals as to where we'll be 6 months from now, whether it's making this permanent or tailoring it down or expanding it?
Well, I will say, if you read the governor's directive to OHA and OLCC and our state agencies, it was to look at permanent legislative fix that may address things like flavor bans or other things that would help us control access to these potentially dangerous products. So we needed to address this emergency rulemaking first, get systems in place to ensure that the rules go into force, that we have mechanisms for enforcement, that we can make sure that people can be linked to cessation services more easily than they were before, even though there weren't many barriers. And then we will concentrate on some of these longer-term asks from the governor and look forward to working together to find some solutions. The governor will be convening a public health vaping work group, and I anticipate many of these things will be discussed through that work group and things will be put forward in the coming months.
Let's try one more time on the phone. Are there any journalists on the phone who would like to ask a question? Hearing none. Sophie?
So I'm wondering, out of the people who have fallen ill in Oregon and have died, does the OLCC know yet what specific products were used by those people and whether or not they contain flavors?
The OLCC isn't separate or distinct in the investigation from OHA or the CDC, so we're under confidentiality in that.
Okay, so,
Sure.
But are you guys aware of what those products are?
Our staff is aware of that have supported the investigation, and we have carried out work on the behalf of OHA to obtain product, find products, and provide them with the opportunity to sample products pulled from the field.
Yeah, So I will just say it's been a great partnership in working with OLCC. As we in OHA interview patients or family members of patients for those who passed away and trying to identify products, as we come up with any products that are that either we know are regulated by OLCC or we think might be, we reach out to them with that information and can utilize what information they have on traceback and can work on getting those products tested. As you've heard, if you've listened to the updates on the national investigation, there have been many products submitted to the FDA for testing of what specific ingredients might be shared in common across many of these illnesses, and we're still waiting for those results to come in. And the same as, that national picture occurs here in Oregon. There's still no definitive results from our products that have been sampled, but we have been working really closely with OLCC on products that do fall under their regulatory authority and getting what information we can.
So I want to follow up on that because I think there's an important point. So those are samples we've taken as a part of their investigation. Next question is, well, what are you doing to look at those products generally in your system? And we are looking at those. We will do some testing of sampling of non-client specific products that samples that we collect to look at ourselves. But one of the issues here is who's qualified to do that testing and what testing capacity exists in state or even nationally at this point. CDC, FDA are swamped with the fatality investigations. Looking at those, and lab capacity is a significant issue right now for our system. I am hopeful and I think somewhat optimistic that we will find types of tests that we have some of the capacity to do here in Oregon and begin implementing that on product now. But we're working with our partners to identify further lab capacity that's capable of doing these tests. And I imagine in the 6-month question that where we'll be, a part of that is going to be a greater testing regime is going to be recommended. That capacity has to be certified, it has to be built, it has to be created in this state. And as you know, we have other lab capacity at the university systems and otherwise that isn't fully accessible to us because they accept federal funds and it's still federally illegal and they are worried about their funding. I hope that the federal government and the DEA and others that have oversight of this can get us some dispensation to be able to use some of that capacity we have to protect people.
Just took 2 more questions. Okay, Channel 2?
I'm
Or
Drew.
Fox, or,
Yeah,
Fox 12.
I'm just curious if the OHA is starting to think about the next steps if after these 6 months it doesn't do anything to curb vaping-related injuries.
I think first and foremost, we're all hopeful that with the Oregon cases being a small part of the national investigation, that this national investigation will start to reveal some answers as to what specific ingredient or product or ingredients or products are likely to be contributing to these. Once we know that, under the governor's order, we do have authority to go back and do rules to remove those products from the market as well. So we hope that we will get some answers soon about what specific products may be causing this acute outbreak of lung injuries. Again, we've known long-term, particularly on the tobacco nicotine side, but many of the same products are in THC and marijuana vaping, that there are other health effects from these products. So part of the governor's directive with this public health working group and looking at other legislative solutions will allow us to consider things that may reduce the use of vaping, particularly among youth, so that we don't have people addicted to these products long-term when we don't know the health consequences. And again, because that group hasn't started meeting, I don't know what those are in particular, but one of the things that was laid out in her order to us was to look at the institution potentially of a long-term flavor ban. So that's something this group will be continuing to look at, as well as other evidence-based strategies for tobacco control.
Okay, the Mercury for one last question, then our staffs will be available for follow-up questions.
Yeah, so the OLCC is responsible for regulating recreational cannabis. In hindsight, are there things you could have done, whether just put more thought into specific health-focused regulations versus legal tracking regulations that could have prevented this?
So that's a good question. I think that that's something we've always been focused on. But you've watched us roll out this system, right? We've done the things we could as we could do them. We've been increasing our staff constantly to be able to deal with the public safety aspects. We put in place a good testing regime. I've already talked about that and about the packaging disclosures and the labeling. But we also have worked with OHA on when we're going to modify our testing regime for the products that we have and the way we were, the pesticides testing, molds, mildew, what we have for our products. But then looking beyond that, right, and in part we have a strong relationship with OHA in creating those additional tests. But now I think we're finding that, we've got to improve our testing regime overall. Now you've seen the problems we've experienced relying on our private lab licensure system for consistency. We've tried to make that process credible, and I think it's improving. We need to keep improving the private lab piece, but we also have to develop some more lab capacity for ourselves. So, Washington State has a public health officer now that's within their cannabis program. Many of the agencies that we're working with nationally are beginning to look that direction. So I don't think there hasn't been a focus on it. It hasn't been clear on what we needed to do and how we get the capacity and resources aligned to develop and evolve to that part of the program. But I will say, this program was established with some sense of risk, right? People are allowed to have the independence to smoke cannabis. Vaping is a question in terms of how much immediate health concerns are there, but we said, at least in Oregon, in spite of the dire concerns, you're still going to be able to vape natural marijuana terpenes and vapes for for now under the temporary rule. But I think it's really like any other public policy. It's about how much risk do we need to protect each individual from, and how much risk do they assume? And in this agency, it's going to be a balance, because we're going to allow people to take some risk. That's what we've been mandated to do, I think, by the law. But we're also not going to do that without a recognition that we got to keep people reasonably or very safe as we do that, and I think that's a balance point that we're finding our way in. But I think it's not that we lost sight of it, not that we didn't have it, it's just that we haven't had all the technology and focus to get us there yet.
I just want to add an important corollary to that. The question was specifically about kind of our market for THC in Oregon, but just as a reminder, the nicotine and tobacco-based products also are not regulated. Not only is there no one in Oregon responsible for that, the FDA does have authority to regulate those products, and there's been, that rule has been hanging out for them for a while. Oregon Health Authority has weighed in and urged them to take action on looking at these products and regulation so that we can have some information about these products. But that's an important thing too. It's not, that these are things that OLCC didn't think of. These are things that aren't happening on the national level with the tobacco and nicotine side of the house. And so these are things that we hope action is taken on so that we can try and better tell people the risks of products that they're using, which right now we don't have all that information.
Just wanted to say thank you to OLCC again for having us here, and thank you all for letting us talk about our rules. I wanted to encourage you to go to our website, healthoregon.org/vaping. There's information on there about our rules. Healthoregon.org also has information about our investigation, which continues. We still have 9 cases in Oregon, including 2 fatalities. And I also encourage you to check out cdc.gov, which has some information about the national outbreak. We have a sample of our health warning that will be in retailers. And then I encourage you also to share our cessation resources here. And we have some, as I said earlier, we have some samples of nicotine replacement therapy, as well as some vaping products. So thank you very much, and appreciate it.